Good afternoon. My name is Paul Edwards in the Governor's Office, and we're grateful to have you here for our daily briefing related to the COVID-19 crisis. I want to just express our appreciation for our media partners who make this possible and your patience with some of the technical difficulties that we sometimes experience, especially for our Facebook users. We hope that you're hearing us again today. We've had some problems with the sound that way. I just think it's helpful for you to realize that this presentation room here at the state capitol is designed for bringing a lot of press in, and since press is not able to be here directly with us due to social distancing protocols, we've set up a pool camera here and a Facebook Live feed and some other things, and we've rigged together essentially a studio within the Capitol that's created a few opportunities for ASL interpretation, for Spanish language translation, and for these daily broadcasts, but there have been some technical difficulties. Also, I'm just going to let you know that today we are going to introduce some new hygiene measures during the conference where I will be wiping down the podium between our speakers. So today we'll have the opportunity to hear first from Governor Gary Herbert. He'll be followed by our state epidemiologist, Dr. Angela Dunn, and she'll be followed by the co-founder and chief strategy officer of 20, Mr. Jared Allgood. And so we will hear next from the governor.
Well, thank you, Paul. Again, it's good to be with you today as we continue to work together against the coronavirus pandemic and the challenge that it faces to us every day. I feel we're certainly making significant headway and winning this battle, and it's because of a lot of people working together and paying attention to the directions that we've given them coming from our health department and those medical professionals who are helping us to guide us so we can get through this. And certainly we want to get the economy back and going. And all those things are working together, and I feel very good and very optimistic about what's taking place. And I think you'll hear from Dr. Angela Dunn today some of the statistics and the numbers, again, showing us that our trend is going in the right direction. So I'm very cautiously optimistic about the next few days and few weeks as far as what we're going to be able to do. With that being said, one of the things that we've taken the steps to do yesterday was to open up opportunities for elective surgery. And this is, again, an incremental step in the right direction. It's our public health order, which we authorized to be released yesterday and taken effect at midnight last night. Again, this is going to help us, at least for the medical profession, help them to do things that they voluntarily at first stopped, and then we, by order, mandated that they could not, in fact, do any elective surgeries, making sure that we had bed space for those who may be patients of COVID-19, and also making sure that we had adequate supplies so that we could take care of COVID-19 or anybody else who has some emergency need. We had personal protective equipment, masks, gowns, and medicine. And so it's been kind of a balancing act, but the good news is we've come to the place where we have adequate hospital beds. The hospitals have assured us that they've got adequate medical equipment, personal protective gowns, etc., as well as the medicine. So it was a time for us to move to this next step, and I'm glad that we were able to announce that yesterday. Let me just give you some more specific guidance. I know there's been some questions come up. What does it mean? Particularly if you're a doctor or a dentist. First, let me just say that if anybody has questions about this, the best place to go get some answers easily is to go to our webpage at coronavirus.utah.gov, coronavirus.utah.gov, and you'll find a place there that talks about the new health public health order, and you can read the order in its entirety. And there's some frequently asked questions there that you can get some information regarding. And I think it'll answer most everybody's questions. But what this means is for those doctors and dentists and others that are concerned, what can they do today that they couldn't do before the coronavirus pandemic hit? The answer is you can perform really about any procedure that you were doing before the coronavirus and the COVID-19. You can do it with some safety protocols and precautions in place. So it's going to be back to very close to business as usual before, with some safety precautions and protocols that need to be in place. For example, anyone who enters into a healthcare facility must be screened by taking their temperature. So you can't come in unless you're screened first with taking a temperature and completing a questionnaire that explains what your symptoms may be. And in that case, that may mean that you'll be asked to stay outside, not come into the facility there, maybe wait in your car or outside in some place until it's your turn to come in. The doctors and nurses will direct you about the protocol at this respective offices. Also, no more than one individual may accompany a patient. So you can't bring your family with you. It's just one individual can be there to escort you and help you. Everyone who comes into a healthcare facility will need to wear a mask when they're within 6 feet of any other individual. And the only time there's an exception to that is if that prevents the procedure from taking place if you had a mask on. So you'll be able to take it off then. But otherwise, when you go to a healthcare facility, we expect you to be wearing a mask. Any toys, magazines, and other items must be removed from the waiting area. Again, that's because we're hopeful that people are not going to be congregating in the waiting area. There will be no congregating in or around a healthcare facility. And as I mentioned already, if possible, patients should wait outside or in their car until it's their turn to come in. Now, this is not an exhaustive list of the protocols. There will be some that will be tailor-made for the individual doctors, dentist offices that they have out there. But again, if you go to our webpage, it'll give you more information on what you can and can't do. Coronavirus.utah.gov. For hospitals and surgery centers, the policy is a little bit more robust, which includes testing for COVID-19 prior to having any kind of surgery. So even though you may not have had it, you're going to be tested for it to make sure that if you go into surgery, that you don't have it. Again, if there's any questions, I would encourage you to work with your doctor, your hospital provider, healthcare provider, to give you additional information. And let me just say, I appreciate the fact that doctors, medical health providers throughout our state, dentists, have worked very closely with us to help us develop these policies and put them in place. They're rational, they're common sensible, and they're going to help us find that balance and make sure that we can open up, again, this part of our economy and yet not risk the health of those that we associate with. So again, I feel very good about what we're asking people to do and how we're going about doing this. Again, our hospital association, our major hospital healthcare providers, they are reporting that they're in a position where they've got all the necessary supplies and protective equipment, certainly for the near term. So we're able to do things and relax some of the restrictions rather, we've had in place before. Now, I guess I just want to say to all of us, this does not mean that the pandemic is over. This is just a step in the direction of recovery. And it's a good step, but it's just a small step. We will continue to monitor the data. Data is what is driving us. It's not fear. It's not politics. We see both of those out in the marketplace today. We're being driven by data and trying to find, again, that right balance point to do what we would do, and just kind of a responsible and common sense approach that we've taken. If we find hospital trends go up and supplies are for our healthcare needs, supplies go down, then we'll have to make some adjustments. So there's always that caveat, But right now, we're very hopeful, and I believe that we're moving in the right direction, but we'll continue to monitor the situation and be vigilant. That's just kind of the nature of the world we live in today, and we're going to continue to do that. So I've got one other thing I'm going to talk about. Before I do that, I want to see if there's any questions on this issue before I move to another issue.
Sorry, it's actually not about this issue. It's about another one. I was about to unraise my hand.
Thank you, Governor. First question I would have, concerning what you just said about the pandemic not being over, we're starting to see protests. There was a protest, obviously, last week in the Capitol. There were also protests in southern Utah about opening things up again. Are you worried that people might have any kind of false sense of it's time to just open everything up and everything will be fine, or anything like that?
Well, as I mentioned, we're being guided by data. We have the best minds available in science and medicine. We're following the trends. The trends are moving in the right direction, and we should appreciate the fact that the people of Utah have been very good. The fact that they followed our directives, that they've maintained social distancing, they've stayed more at home than they ever have before. We have more telecommuting for businesses. We haven't really shut down the economy entirely, and we've been accused by others of not doing enough. Again, we've tried to find the right balance. It's easy to sit on the sidelines and criticize, and we have a lot of people that I guess are looking forward to taking the opportunity to do that. But unfortunately, they don't have all the information. And generally in the criticism, which is easy to do, they don't have all of the information. So sometimes their criticisms are incorrect or off base. And so we're doing the best that we can with the information we have. And the good news is right now, latest information shows us that our infection rates, what we pass on to other people, it was that we had one infection and 5 others they were infecting. Now we're down to 1 infected person infecting 1.2 other people, maybe down to 1.1. If we get to 1-to-1, that is going to be stabilization. That means we have no more getting infected than we have that are infected, so the number stays stationary. Our goal, of course, is to get to 1 to less than 1. So that if we had 1,000 people affected, but we're going to 1 to 0.9, then over time you'd be to 900, and then you'd be to 7,200, and gradually your numbers would get smaller. That's the goal. That's where we need to be. And we'll be talking a little bit more about that in a minute as far as what we're going to do to try to help accelerate that. But again, I know people are anxious and they want to have the economy opened up. We do too. And we're on the verge, I think, of moving out of the urgency phase into more stabilization. Certainly in our Utah Leads Together 2.0, where we have a color code of red, orange, yellow, and green, I think we're getting close to being able to move out of red into orange. And so you're going to see things starting to open up. We've already announced things like our parks and opportunities for our gyms and golfing and other things that are starting to open up. More on that to come here in the next week. But things are starting to open up, and I think people should be cautiously optimistic that that will continue.
Hi, Governor. Thanks for taking the question. I was curious about the pending purchase of these anti-malarial drugs, hydroxychloroquine, I believe. I'm wondering if there was any effort to have those donated or perhaps procured from the federal stockpile that you know of before that decision to purchase was made.
Well, we're taking every opportunity to look at every avenue, and we have a lot of public donation from private entities. We just announced yesterday what's being done with Merit Medical and providing new swabs as well as vials and reagent. Again, that they're doing, helping us get a supply chain of where we have actually a bottleneck in the testing. There are a lot of people who are stepping up, whether it be from Silicon Slopes. We've had Apple has donated a lot of things to us. So the private sector is stepping up significantly. We have private-public partnerships. Hydroxychloroquine has been a drug that people have touted as maybe an answer to help with the severity and the longevity of the COVID-19. It's not without controversy when it comes to people saying it does work or doesn't work, and debating on what the clinical trials, or at least the minor studies, because I don't think there's been any clinical trials yet, does when it comes to the COVID-19. That being said, we need to make sure we have a stockpile of that drug for malaria and lupus. And the concern is if people use it for other reasons, off-label uses, that there won't be enough for those who really need to use it for these other things that it was prescribed for originally. So again, it's a balancing act of making sure we're rational, that we're responsible, and we're doing things based on good science and good data, which is what is driving us, nothing else. So I think we're doing this in a responsible way.
Hi, Governor. Nick McGurk from ABC4. Thanks for taking my question. I actually have a couple, but we can just stick to the first one. I know you talked about data. Can you just talk about how the CDC warning about a second wave come winter? I mean, how the state is preparing for that? And then one other question I had in case I don't get another shot at this. In terms of bridge loans, I know a lot of folks are waiting for the federal government to not get their act together, but to get some more funding to small businesses. I don't know if you can touch on whether the state might have funding for another round for small businesses who are, quite frankly, worried about their survival.
Sure, thank you. Again, your one question will lead me into my final comments and talk about what we're doing about if could be another surge, the COVID-19. Some have referred to that as a second wave. I don't know if that's an accurate description, but certainly we're concerned about the ups and downs of the COVID-19. And until we find a vaccine and are able to be inoculated against it, we always will have to worry about some kind of a resurge of the COVID-19 virus. Certainly for small business, we're very concerned. We've had $2.2 trillion have been put into the marketplace, as well as increasing in unemployment insurance by $600 a week. The concern we're facing now, interestingly enough, is do we have people that actually are making more money on unemployment insurance than they did on the job? And are they going to hurry to get back on the job? Or are they going to say, hey, this is pretty nice, I'm making more money on unemployment than I did on the job? That's a real legitimate concern out there in the marketplace, not only here in Utah, but across the country. We certainly are working with the legislature to see what we can do with some of our own rainy day funds to augment in helping businesses. Our GoEd office has worked on small business loans to the tune of about $11 million right now. There may be some more monies that we will see from the legislature. We were talking about that ongoing, about where do we need to kind of fill in some gaps and maybe help where some of the federal monies has not been made available, or at least not being made available. There's another round of monies that will be voted on, I think tomorrow, about $484 billion, which will be going into businesses and healthcare and hospitals to help fill some of the gaps that are there. And so I expect that will happen tomorrow. It may be even more than that, but 484 billion is the number that I've heard, but it could be as high as 500 billion. So there's work out there. I mean, it helps on the way, and actually the federal government, Congress are doing things, the state's doing things, and this will be the largest infusion of monies from the taxpayer to help build the bridge for business that's ever been done probably in history of the world. So there's a significant effort out there, and we understand the challenge. And again, we talk about this with the legislature every day, which controls all the money, of course, and that's their responsibility, and see how we can best utilize our rainy day funds to help particularly small business weather this storm. So stay tuned. Let me move to this other issue here I wanted to talk about. It does have to do with testing. Testing, as I've mentioned, has been the biggest challenge across the country for every state. I just was on a phone call with the governors here just an hour ago, and testing still continues to come up. We don't have enough tests. We're not having enough people take the tests. And here in Utah, we've had a significant increase in those who are taking tests, over 4,000 per day. And that's a step in the right direction. We'd like to have even more. We're saying for people, if you just have one of the symptoms, then you should go through testutah.com or talk to your local health provider and say, I have a symptom, and let's see if you need to get a test. We have the capacity to test people, and we still have some headroom. So we want to have as many people tested as are available to be tested and want to be tested if you have a symptom. So we still have to screen it a little bit to prioritize those who have symptoms. Nevertheless, the fact we're doing over 4,000 a day is a step in the right direction to help us find out who's got it and who doesn't, and what we can do to slow the spread and secure those who don't have the virus. To that end, having the right tools in place, and we've talked about the need for swabs and reagents and lab testing, as well as the facilities to drive to and conveniently take the test and get results back in a timely fashion, and the challenge we faced. It's really about having the right tool in a toolbox to help us do this. And if we're going to return to normalcy until we get a vaccine, these tools are going to help us, in fact, slow the spread of the COVID virus and stop as much as we can its spread. So today I'm announcing a new tool, the first iteration, what we would call a beta launch. So this is a new test. It's brand new, and it's called the Healthy Together app. The Healthy Together app. And this is a tool that's going to help us to care for ourselves, for each other. It's going to help us to vigilantly track those who have the COVID-19 and those that they may come in contact with to, again, slow down this progress and get people that are exposed to it health care if they need it, and certainly testing. This mobile app will help you and your loved ones to track symptoms and connect easily with those who are going to do the testing on COVID-19. It's going to help you assess your symptoms and connect with the many testing facilities we have. I think we're approaching now 50 testing facilities in the state in all parts of Utah. So access is becoming better. This app will help you to, every day it reminds you that check your symptoms and see if you're in need of a test. It'll remind you to go through and answer these questions. And what happens is once you have this app, it tracks where you go. And if you happen to bump into somebody that has COVID-19, you don't know it, they don't know it, but eventually the database that this is attached to will give an alert. So if somebody has COVID-19, it can actually go back and trace who you bumped into and say, by the way, you've been exposed to COVID-19 when you're at such and such a location, and recommend that you go in and have a test done on your own health needs. So this is a process called contract tracing. You've heard us talk about the need for us to contact people and track where they've been and trace where they've been to see if we in fact can isolate those who have gotten the COVID-19 from those who don't. This is going to help us identify and protect others. So this Healthy Together mobile app and analysis technology will provide substantial support to Utah's public health contract tracing that we're already doing. This will expand it and make it more efficient. And you'll be able to share the information with our state health workers in a faster, more accurate manner. And by the way, this is not only going to help us do this, but I want people to know this is voluntary. You don't have to do this. That may be a good idea, we think, for you and for others. But this use of this app will always be voluntary. It's a new tool we're testing, which we think will add to the tools in the toolbox to help us with this. And protecting your data is going to be of utmost concern for us here in the state. And to ensure the privacy and security of your data, we've agreed by contract that data use will follow these principles and limitations. One, the use of the app is strictly opt-in and voluntary. Two, users own their data and can delete the data anytime they choose. Only data that is required to combat COVID-19 will be shared with the public health officials. Location data will automatically be deleted in 30 days. Symptom data will be automatically de-identified in 30 days. And the Healthy Together will comply with state requirements for data security and encryption. So again, we're putting protections in place so that people don't have to worry about this data being used inappropriately. And again, it's always voluntarily, and you control and you own the data yourself and can delete at your desire. I think this can play a good, healthy role in helping us attack an enemy which is invisible. You can't see the virus. We don't know where it's at. This will help us in some ways see better into the marketplace than we would otherwise be able to do so. So this app is just another tool that's going to help us. And I'm excited this is going to be a step again towards helping us slow down the spread and keep us safe and healthy, and certainly help us again continue to open up more of the economy as this takes place. So you can learn more about the app and how it works by again going to our coronavirus.utah.gov, our webpage coronavirus.utah.gov, where you'll find a link there that can talk to you about this new app, Utah Together app, and frequently asked questions, and you can get information there that will help you understand. But also to that end, we are going to hear from Dr. Angela Dunn, and also we've asked Jared Allgood, who's helped develop this new technology, to come and speak to us in a little more detail so that people understand the benefits of this new app that will help us in this fight against the coronavirus. So with that, I thank you very much, and we'll invite Dr. Dunn to come first. We're going to wipe this down.
All right, good afternoon. Thank you, Governor Herbert. Oh, perfect. Thanks, Paul. Great. So today I want to share our situational update first, and then I'll talk about how public health is going to be using the Healthy Together app. Today, we have 3,445 total cases of COVID-19 identified in Utah. This is an increase of 149 cases from yesterday, or a 4.5% growth rate. We're reporting a total of 76,460 people have been tested for COVID-19 in Utah. That's an increase of 4,075 from yesterday, and we're now at a 4.5% positive rate. So seeing a slight decrease in that positive rate, which is a good sign. Unfortunately, though, we are reporting 34 deaths today. That's 2 additional deaths from yesterday. Both deaths were among people older than the age of 85. One was a Salt Lake County resident and was part of a long-term care facility outbreak, and the other was a Utah County resident who was hospitalized at the time of death. So today's launch of the Healthy Together app is an exciting development. It is the latest example of how Utah is thinking creatively and outside of the box to really address this pandemic. We know that the tried and true public health activities such as testing, case investigation, contact tracing, and active monitoring do work to slow and stop a pandemic. And this app is going to complement those efforts to increase our testing and ensure that we have a robust contact tracing program. So on the testing front, people can download the app, check their symptoms every day, and get guidance on whether or not they should be tested, and even identify locations convenient to them where they can get testing. So if you decide to download the app and you eventually test positive for COVID-19, when a public health case investigator contacts you, you can choose to share your location information from the app with that case investigator. Traditional contact tracing is a human process, and with that, we have human error. It relies on an individual's ability to remember exactly where they've been and who they've come into close contact with over the past several days or even several weeks. So you can imagine that relying on someone's memory for those things can leave some holes and gaps in our contact tracing. So the Healthy Together app injects technology into this human process, and it can provide a more thorough picture to our contact tracers regarding a positive case's potential exposures. So if you choose to share your data with our contact tracers, they'll be able to know about the places that you've been while you were infectious, and it'll also provide our contact tracers with a snapshot of other app users who you had significant contact with and potentially exposed with COVID-19 as well. That will allow our contact tracers to follow up directly with anybody who is potentially exposed to COVID-19 and provide them the necessary information to protect themselves and others against COVID-19. And this will help us stop the spread of COVID-19 in Utah. It is really important to realize that this information will only be shared with public health workers if you choose to share it. It's never going to be shared through the app with other app users and will not be shared with the app developers. As our state leaders work to determine how and when to most responsibly relax social distancing restrictions, having tools to better address testing and tracing are key to this. But I also recognize that the success of this app is tied directly to your trust in us and our ability to safeguard your information. And for that, I'll turn the time to Jared Allgood. He's with the company 20 who has worked with us to develop this app, and he'll explain kind of the robust privacy features that we've built within the app to protect your information. Following Jared, we'll take questions on the app and other public health things. Thank you.
Jared Allgood. Thank you.
Thank you, Paul. Good afternoon. I'm Jared Allgood, co-founder of and chief strategy officer of 20. On behalf of the Healthy Together team, we're very grateful for Governor Herbert's leadership with the Utah Leads Together 2.0 initiative. We're grateful for all of the efforts of the governor's team, Dr. Angela Dunn, and the many healthcare workers, public health, state officials who have been putting in countless hours to work with us and to work with the community to stop the spread of COVID-19. Dr. Dunn did a fantastic job describing how Healthy Together will benefit Utahns who use it and how it will enable public health workers and contact tracers to go directly after coronavirus. As the state moves from urgency into the stabilization phase and think about the future, we believe a tool that supports residents, public health, and state officials in concert is critical to safely reopening our communities and our economy. So I'm here today to share a few comments about our approach, how it differs from automated contact tracing, and how we safeguard user privacy. So rather than build a Bluetooth-only system that would require over 80% adoption rates to be effective and relies on automated alerts to encourage people to change their behavior, we built a system with the primary goal of supporting public health workers in the work they do to contact trace and limit the spread of COVID-19. Our approach, because it involves both Bluetooth and location data, opt-in from users, will have an immediate impact. To do this, we built a framework for data privacy that supports both public health and protects the data privacy of Utahns. So I'd invite anybody who participates in the app to read our privacy policy. It's clear, it's readable, it's straightforward, and as the governor mentioned, it has specific guidelines and principles that we want to make sure everybody is aware of. First, users own their data. They're always in control of their information and they can delete it at any time, and this is simply done through the interface of the application. Healthy Together automatically de-identifies all symptom survey data after 30 days when it's no longer useful for a direct public health response effort. We also automatically delete all location and Bluetooth connection data after 30 days. Whatever data is shared with public health is subject to these same de-identification and deletion restrictions. And finally, the umbrella that governs all of this data that gets collected, that users are sharing voluntarily, is information that will be only used in connection with a COVID-19 response effort. So with that intro, I guess we'll open it up for questioning.
Yeah, this is a question for Governor Gary Herbert, if he is still there. Governor?
Governor won't be with us.
Oh, okay.
Oh,
I guess the
yes.
question I
I'm
have
sorry.
then is, how do you make people get over this hurdle of privacy concerns, just given some of the issues the state has faced lately with use of data and, surveillance-based, surveillance-style apps that track your location where you are for good or for bad?
For some, we can never get over that hurdle. They're concerned, Big Brother watching their every movement. I understand that concern and that fear. So I don't know that we can ever appease everybody. That's why it's voluntary. If you don't feel good about it, don't feel comfortable, we're not expecting you to participate. We're trying to give every indication that you're in control of the data, so you know where it's going. You can look. We're certainly happy to have people take a look at our processes to make sure that others feel careful as they inspect what we're doing. So again, this is just designed as another tool. It's not perfect, but it will help us augment our ability to slow the spread and stop it from spreading in the population. And not only protect you, but protect others. Again, if I was exposed and didn't know it, and if I had this app, if I was out doing whatever I'm doing at the grocery shopping and I passed somebody and the apps would indicate that sometime that a person I met and stopped and maybe chatted with in the store had COVID-19, it would be able to track me down and say, you might want to get yourself checked because the person you talked to on this date had this COVID-19 virus. So again, it's a help, and we'll try to make sure it's open and transparent to everybody. And we hope that people will understand that for what it is and not make more of it than it's not intended to be.
And Governor, the company 20 has a multi-million-dollar contract with the state for this app, and Silicon Slopes Commons is disclosing that some of its companies behind Test Utah are also getting contracts with the state now to help manage that. When it started as a volunteer effort, did you envision state contracts with these companies when they offered up some of these ideas and solutions as you responded to the pandemic?
I think it's always been kind of an uncertain pathway we've taken because this has never happened before. But I do believe that as people design and spend money and take risks, that if they come up with a better mousetrap, that we probably are interested in buying it if we are trying to collect from the mice. So I don't think we've ever envisioned it, but it's certainly something that's not unusual, as we in fact contract with a lot of different companies to provide us with additional help and services. Again, it's a competitive basis. We have a lot of people that apply all the time to say, we've got something that you can utilize. We have RFP processes, we have bid processes that we go through. Some we take and some we don't.
Hi, I have, I guess, 3 questions. One, how much money did the state pay for this app, for this contract? 2, how many Utahns will need to download it and install it in order for it to be, I guess, an effective tracking tool? Do you have a percentage or just like a net number of people? And then 3, I downloaded the app already, and I'm given a questionnaire about symptoms that appears to be quite similar to the one from testutah.com. Now that the state has 2 different online platforms for symptom checking and whatnot, is there any concern that people are going to use one and not the other, and therefore the data will never actually be fully collected, or that having done Test Utah will, I guess, deter people from doing this one?
Thank you, Erin. As to the cost of the contract, we understand that the state has spent about $1.75 million to date, and that there is another $1 million that is part of the contract to help with the development of further iterations of the application. As we mentioned, this is in beta form right now. To put that into context, by being able to work with a company like 20 that has spent tens of millions of dollars developing specific technology and IT and IP that is specific to this challenge of being able to provide information that will be useful for tracing and tracking, as well as the other features. It's a useful opportunity for us to take advantage of that. The second question that you had was about what kind of saturation in the marketplace do you need in order for this to be effective? And as Jared explained earlier, what's different about this than some of the programs that you've seen deployed in places like Iceland and Singapore that have depended on mass adoption in order for it to be helpful. Any adoption of the Healthy Together app is very useful for us in Utah because it provides not only the ease of helping people to get themselves assessed and to appropriate testing as quickly as possible, which in and of itself is a benefit, but the kind of tracing and tracking that's available there for any case, should someone become symptomatic, is useful to the team of health workers that are working with the Utah Department of Health to trace and help us to contain this thing. So it's any amount of adoption will be useful to us. And I think the final question was about the data. And
I was asking because of the data collection measure.
The different, it uses, as you're very observant, Aaron, you're very observant that this is indeed the same protocol that appears on the Test Utah site that appears on this site.
Okay, so I guess does that mean that in terms of, people are going to one of these things perhaps to find out whether they need a test and the state's using that as part of data collection? I mean, we have now two competing apps. Is that going to split up the amount of data that will ultimately be available?
No,
so platforms, I mean.
Right. So both the testutah.com on the website and this app feed directly into the Department of Health surveillance system. And we have the ability to deduplicate across the system so that we are assuring that we only have one individual's record at a time. So if a person uses the app and the website, we're able to understand that on our end at the health department and coalesce it into one record.
Hi, this is Brittany with ABC4. Questions for the governor and for Dr. Dunn. The question for the governor, Governor Gary Herbert, you said that additional things are being done to help small businesses. What, in addition to PP loans, are being done, especially for those who didn't receive a loan in the first round and who haven't received any funding from the economy injury disaster loan? And there's a possibility that these companies won't receive funding in the next round of PPP if it does pass. My question for Dr. Dunn, the numbers you gave today, do those numbers include the number of COVID-19 cases released from the Salt Lake County Jail this afternoon? And speaking of the jail, what's being done to help slow the spread of the virus and protect inmates since they're in such close quarters with each other? Do they need to take any additional or other protocols when it comes to social distancing or slowing the spread?
In regards to the small business loans, again, I've mentioned already that we have $11 million that our GOED office has put out to small businesses in small amounts in loans. The legislature and I are working together to see if there's some opportunities with some of our rainy day funds to match with some of the federal monies that are coming in. Utah will be receiving about $1.25 billion, probably when all is said and done, up to $2 billion that will come from federal funds, which really comes from the same pockets of Utahns, by the way. That's not anything magic back in Washington, D.C. It will add to our debt. It's another issue that needs to be addressed in a future time. We have some concern, as I've talked with governors just as recently as this morning, about is the money's being applied equally and fairly to businesses across the country. We have some businesses that are surprised that they're not being approved for a loan, and other businesses that are getting more than maybe what they even thought they needed. And so I think there's some inequities in the system on the federal monies anyway. But that being as it may, we're trying to look and see what we can do to fill in any gaps here in the state of Utah that were found. This additional money that's coming out, if it passes tomorrow, will be another $484 billion, up to $500 billion, which will help to fill in some gaps for businesses too. So again, governors are arguing, I shouldn't say arguing, I guess discussing with the White House and with the leadership in the House and the Senate of what they should be doing, particularly to help states. None of the money really is coming to help states in their loss of revenues. So we've probably been on the shorter end of the stick than some, but our work through the National Governors Association with all in a bipartisan way is certainly helping to influence monies that the Congress is putting up to help small business. And that will continue. Will be another wave tomorrow of money, and I'm not sure that's going to be the last wave either. So we're doing all that we can to make sure we're responsible with the taxpayers' dollars. Certainly it's in a state that's one of only 12 that has a AAA bond rating. And the fortunate thing for us is we do have a rainy day fund, which is going to help us get through this rough patch of road and also help some of the businesses along the way.
Thank you. So your question about the outbreaks in the jail. So we're working with our local health department to really assess what has gone on, and we'll have an update for you tomorrow on that. I'm not sure if they were captured at the time that we updated our numbers. So I'll definitely let you guys know tomorrow more information about that situation. But we have been working with our incarcerated population from the beginning of this, recognizing that they are a vulnerable population given the congregate setting. So there are protocols in place to cohort inmates and staff based on symptoms and be able to limit the spread effectively in those situations. They are also a priority spot for the rapid testing so that those facilities can identify whether or not somebody who has symptoms is positive for COVID-19 and take the appropriate steps there. So that has been a priority population from the beginning of this outbreak.
Mr. Allgood, as we don't have a demo in place on the app, I'm just wondering, Dr. Dunn, we've spoken about asymptomatic spread, which was your term, and we wonder how the tracking and specifically for those that do not have any symptomology, if they want to just use this app to be able to be notified if they've come in contact with someone, wouldn't that already have been done? Does this just automate the process and facilitate the response by the health department, or is there some other benefit that we're not seeing here?
Yeah, so this app does not have automated notification in it. So what it does is it augments our current process that's in place and allows our public health case investigators to access an individual's location history if that person allows a public health investigator to do it. So what it's really doing is helping us in our contact tracing process in terms of really being able to identify more readily where a positive case has been during their incubation and infectious period so that we can identify other close contacts and appropriately advise them. So this is really helping with that process that's already in place and allowing us to be more effective and thorough in our current processes.
So in terms of adoption, are we understanding that it's your desire, the health department's desire, to have everybody using the app, as many people as possible? I heard that go by, but I'm trying to understand how that works to the benefit of the general public in a trade-off regarding privacy.
So again, it helps if even just one person downloads it. We're not relying on saturation for this to be effective. It is a tool that if individuals want to download it and assess their symptoms and get connected to testing, they can do that. And if they become positive, they have the ability or the option to share their location information with public health if they choose to do so. So any individual who chooses to download it, it would be helpful for public health, but of course we're leaving it up to the choice of the individual to be able to do that or not.
According to some of the reports I've seen, it looks like Utahns were getting kind of bad grades when it comes to social distancing, and they used cell phone data in order to kind of come to that conclusion. As more people download this app and decide to share their information, I mean, stands to reason we would have a lot more people possibly exposed to the virus than we originally thought. Is the state ready for a huge increase in the number of tests? based on this information that people are getting from the app? And are we worried that maybe it might cause some people a little bit more concern, maybe a little bit of a panic even?
So this app is just another way for individuals to assess their symptoms, similar to going to testutah.com and filling out that survey or calling a telehealth provider and getting their symptoms assessed this way. We just want to give every Utahn any option that feels most comfortable to them to assess their symptoms and get connected to testing. We're lucky in the state of Utah to have a great capacity for testing, and it's not filled at this point. So we do have the capacity and the ability to test people who have symptoms consistent with COVID and get them tested quickly. And we also have the capacity to do contact tracing for those individuals. So we are prepared, and we are in a very fortunate spot here in Utah because of that. So again, if people want to download the app, it is an option, and they can use it to assess their symptoms and get connected to testing. And they can also choose to share their location information with public health if they do turn positive, but none of that is a requirement.
Again, we'd like to thank you for joining us this afternoon. We're grateful to our media partners for making this available, and we look forward to seeing you tomorrow at 1:30. Thank you.